Randomized controlled trials, or RCTs, stand as the undisputed gold standard in research methodology. They represent the pinnacle of scientific rigor, offering the most reliable evidence for evaluating interventions. This robust design is fundamental to advancing our understanding in many critical fields. While primarily associated with medical research, RCTs are not confined to clinical settings. Their principles are widely applied across various disciplines. They are essential for developing new treatments, understanding disease progression, and ensuring patient safety. Beyond medicine, RCTs play a crucial role in public health initiatives. They help assess the effectiveness of vaccination campaigns, health education programs, and policy changes. Their application extends to fields like education, economics, and social sciences, wherever intervention effectiveness needs rigorous evaluation. The main purpose of an RCT is to evaluate the effectiveness of an intervention. This involves determining whether a specific treatment, program, or policy produces the intended outcome. RCTs aim to provide clear, unbiased answers to critical questions about what works and why. The design of a randomized controlled trial is meticulously crafted to minimize bias. This systematic approach ensures that the study's findings are as objective and trustworthy as possible. Every element, from participant selection to data analysis, is geared towards this goal. RCTs provide the strongest evidence for establishing cause and effect relationships. Unlike observational studies, they allow researchers to confidently attribute observed changes to the intervention itself. This makes them invaluable for informing policy and practice. The fundamental mechanism underpinning an RCT is the random assignment of participants. This process is not arbitrary, it is a carefully executed statistical technique. Randomization is key to creating comparable groups, which is essential for valid comparisons. Participants in an RCT are assigned to distinct groups. Typically, there are at least two groups, a treatment group and a control group. This division allows for a direct comparison of outcomes under different conditions. The treatment group receives the intervention being studied. This is the core focus of the research, as scientists want to understand its impact. The intervention could be a new drug, a novel therapeutic approach, or a specific educational curriculum. For instance, in a medical trial, the treatment group might receive a new experimental medication. In a public health study, they could participate in a targeted health awareness program. The intervention is the variable whose effect is being measured. The control group receives a control intervention, which serves as a baseline for comparison. This group is crucial for determining if the treatment group's outcomes are truly due to the intervention. Without a control, it is impossible to isolate the intervention's effect. There are several options for the control intervention. One common choice is a placebo, an inert substance or procedure designed to resemble the active treatment. Placebos help account for the psychological effects of receiving treatment. Another control option is standard treatment. This is used when an effective treatment already exists for the condition being studied. The new intervention is then compared against the best available current practice. In some cases, the control group may receive no treatment at all. This is typically done when there is no existing effective treatment or when studying preventative measures. The choice of control is a critical design decision. The specific research question dictates the most appropriate control option. Researchers carefully consider ethical implications and scientific validity when making this choice. The goal is always to create a fair and meaningful comparison. Random assignment is a truly crucial element of randomized controlled trials. It is the cornerstone that distinguishes RCTs from other research designs. This process ensures the integrity and validity of the study's findings. By randomly assigning participants, researchers ensure that the groups are as similar as possible at the study's outset. This means that, on average, characteristics like age, gender, severity of illness, and lifestyle factors are evenly distributed. This balance is vital for accurate comparisons. Random assignment minimizes the influence of confounding variables. Confounding variables are factors that could affect the outcome but are not the intervention being studied. If groups are unbalanced, these confounders could skew the results. The randomization process effectively distributes known factors equally across groups. For example, if a certain percentage of participants have a pre-existing condition, randomization ensures that this percentage is roughly equal in both the treatment and control groups. Crucially, random assignment also distributes unknown factors equally across groups. This is one of its most powerful advantages. Researchers cannot account for every possible variable, but randomization helps balance even those they haven't identified. This meticulous balancing act helps isolate the effect of the intervention. When the groups are comparable in every way except for the intervention, any observed differences in outcomes can be competently attributed to the intervention itself. This direct attribution is what makes RCTs so powerful. Ultimately, random assignment significantly increases the likelihood that observed differences between groups are genuinely due to the intervention. It strengthens the causal inference, allowing researchers to make robust claims about effectiveness. Once participants are assigned, both the treatment and control groups are followed over a specified period. This follow-up duration is determined by the nature of the intervention and the expected timeframe for outcomes to manifest. Consistent monitoring is essential. Throughout this period, researchers meticulously measure outcomes of interest. These measurements must be standardized and objective to ensure accuracy and comparability. Data collection protocols are rigorously defined and adhered to. The outcomes can be diverse, depending on the study's focus. They might include objective measures like disease progression, such as tumor size or viral load. They could also involve subjective assessments like symptom relief, measured through patient-reported scales. Furthermore, outcomes can encompass behavioral changes, such as adherence to a new diet or exercise regimen. In educational settings, outcomes might be test scores or skill acquisition. The chosen outcomes must directly address the research question. Blinding is often employed in RCTs to further reduce bias. This technique prevents participants, researchers, or both from knowing who is receiving the active intervention and who is in the control group. It adds another layer of objectivity to the study. In a blinded study, participants may be unaware of their group assignment. This prevents their expectations or beliefs about the treatment from influencing their reported symptoms or behaviors. This is particularly important for subjective outcomes. Similarly, researchers may be unaware of participants' group assignment. This prevents their unconscious biases or hopes for a particular outcome from influencing how they interact with participants, collect data, or interpret results. In single-blind studies, either the participants or the researchers are unaware of the group assignments. For example, participants might not know if they are getting the drug or the placebo, but the administering staff might. Double-blind studies are considered even more robust. In these studies, both participants and researchers are unaware of participants' group assignment. This dual blinding provides the highest level of protection against bias. Blinding helps prevent the placebo effect, where perceived benefits arise simply from the belief in receiving treatment. If participants don't know what they're getting, the placebo effect is evenly distributed across groups, where its influence is minimized. It also reduces the potential for researchers to unconsciously influence results. Without knowing who is in which group, researchers cannot inadvertently treat groups differently or interpret ambiguous data in a way that favors one outcome. Despite their strengths, randomized controlled trials are not without limitations. They can be expensive to conduct, requiring significant financial resources for participant recruitment, intervention delivery, data collection, and analysis. This cost can be a major barrier. RCTs can also be incredibly time-consuming. Many interventions require long follow-up periods to observe meaningful outcomes, especially for chronic conditions or long-term effects. This extended timeline adds to the complexity and cost. Furthermore, RCTs can be difficult to implement in certain situations. Logistical challenges, such as recruiting a sufficient number of participants or delivering a complex intervention consistently, can hinder their feasibility. Ethical considerations may prevent random assignment in some cases. For instance, it would be unethical to randomly assign people to a harmful exposure or to withhold a known effective treatment. Ethical guidelines always take precedence. RCTs may not always be suitable for complex social interventions. Programs that involve multiple interacting components or require community-wide implementation are often challenging to isolate and randomize effectively. Their effects can be diffuse and difficult to measure. Another challenge is that results from an RCT may not always be generalizable to wider populations. The specific characteristics of the study participants or the controlled environment of the trial might not perfectly reflect real-world conditions. Study participants may not be fully representative of everyone who could benefit from the intervention. They might be healthier, more compliant, or have different demographic profiles than the broader population. This can limit the applicability of the findings. Despite these limitations and challenges, randomized controlled trials remain a cornerstone of evidence-based practice. Their rigorous design and ability to minimize bias make them indispensable for generating reliable knowledge. They continue to shape our understanding of effective interventions. RCTs provide invaluable insights into intervention effectiveness across numerous fields. They allow us to confidently determine whether a new drug works, if a public health campaign is successful, or if an educational program yields better outcomes. This evidence is critical for progress. Ultimately, the robust findings from RCTs guide informed decision-making in various fields. From clinical guidelines and public health policies to educational reforms and economic strategies, the evidence generated by RCTs helps ensure that decisions are based on the most reliable scientific data available.